If you have high cholesterol, you've probably seen ads for supplements promising to lower it naturally. Berberine, fish oil, garlic, red yeast rice. But what does the science show? Researchers put several of the most popular cholesterol supplements to the test in a head-to-head clinical trial called the SPORT trial, published a few years ago. Participants were assigned to either a low-dose statin, placebo, or one of the several popular supplements. The results? The statin lowered LDL cholesterol by nearly 38%. The supplements, on the other hand, none lowered LDL significantly compared with placebo. But that doesn't mean every supplement is useless. I'm Dr. Raj, board-certified family medicine physician, and this is a topic I discuss with my patients every week. Today, we're breaking down what the evidence actually says about the most popular cholesterol supplements and which ones I would and wouldn't recommend. Let's start with the supplement that probably has the strongest cholesterol-lowering evidence, red yeast rice. Red yeast rice contains a compound called monaclin K. What's fascinating is that monaclin K is chemically identical to lovastatin, one of the original prescription statins. In other words, it lowers cholesterol using a similar mechanism. It blocks an enzyme in the liver that's responsible for making cholesterol, HMG-CoA reductase. Multiple studies have shown that high-quality red yeast rice can meaningfully lower LDL, sometimes by amounts comparable to low-dose statins. So why don't I routinely recommend it? Because unlike prescription medications, supplements are not standardized. One bottle may contain very little active ingredient, another may contain much more, and some products have been found to contain citrulline, a contaminant that may be harmful to the kidneys. In clinic, I see patients who are hesitant to take a prescription statin but are comfortable taking red yeast rice. What I explain is this: if red yeast rice is working, it's essentially working because it contains a statin-like compound. The challenge is that you're getting an unregulated version in the form of a supplement. Given these nuances, I recommend a thorough discussion with your physician and extensive research into the quality of the product prior to using it. The supplement I get asked about most often right now is probably berberine. Berberine is a plant-derived compound that affects several metabolic pathways. One of its most interesting effects is that it appears to increase LDL receptors on liver cells. Think of LDL receptors as mini vacuum cleaners that pull cholesterol out of the bloodstream. The more receptors means more LDL removal. Berberine may also influence a protein, PCSK9, which is a target of some modern cholesterol-lowering medications. Clinical trials suggest berberine can produce modest reductions in LDL, and some studies have also found significant improvements in blood sugar. So that's the good news. The bad news, the evidence is still limited compared with prescription therapies. We don't have strong long-term data showing that berberine reduces heart attacks, strokes, or cardiovascular death. It also commonly causes gastrointestinal side effects such as bloating, cramping, and diarrhea. And because berberine can interact with many medications, it's not something I'd recommend starting without discussing with your physician first. Now let's talk about garlic. This is one of the oldest and most popular cholesterol supplements in the world. The theory sounds promising. Garlic contains sulfur-containing compounds that may influence cholesterol production and overall inflammation. But when researchers have actually tested garlic supplements in clinical trials, the results have been underwhelming. Some studies showed tiny reductions in cholesterol levels, while others showed no meaningful benefit at all. And importantly, the SPORT trial found that garlic performed no better than placebo for lowering LDL cholesterol. Now, that doesn't mean garlic is useless. Fresh garlic can be a valuable part of a well-balanced diet. With that said, taking a garlic pill is very different from eating garlic. So if your goal is lowering LDL, there are much more effective options. Skip this supplement. Now let's talk about the interventions that probably deserve far more attention than they're getting: plant sterols and soluble fiber. Plant sterols look structurally similar to cholesterol. Because of that, they compete with cholesterol for absorption in the intestines. As a result, less cholesterol makes it into the bloodstream. At about 2 grams per day, plant sterols can lower LDL cholesterol by roughly 5 to 10%. That's respectable, but my favorite option in this category is soluble fiber, specifically psyllium husk and beta-glucan. These work differently. Soluble fiber forms a gel in the digestive tract and binds bile acids. Your body then has to replace those bile acids, which requires pulling cholesterol from the bloodstream. The result is a modest but reliable reduction in LDL. One of the things I like most about soluble fiber is that it checks a lot of the boxes. It's inexpensive, it's generally safe, it may improve blood sugar control, it often helps people feel fuller, and it really is the most natural of the bunch. While both come in the form of supplements, psyllium husk powder can be mixed into water, while beta-glucan is naturally found in oats. So for many people looking for a natural, safe approach, this is where to start. Before we get to the final takeaway, let's talk about one supplement that millions of people take for cholesterol: fish oil. This is where a lot of confusion exists. Fish oil can absolutely lower triglycerides. That's well established. But LDL cholesterol is a different story. For lowering LDL, fish oil is not the right tool. Some formulations may actually increase LDL slightly because of the DHA component. So if your primary goal is lowering LDL, fish oil probably isn't the supplement you're looking for. One important caveat here, I'm talking about over-the-counter fish oil supplements, whereas prescription omega-3 medications, on the other hand, are a different story. For example, healthcare providers sometimes prescribe a purified EPA product for people with high triglycerides. Unlike many fish oil supplements over the counter, this one is regulated and generally does not increase LDL cholesterol. Finally, there's niacin. Niacin can improve cholesterol numbers on a lab report. The problem is that when researchers tested whether it actually reduced heart attacks and strokes, the answer was disappointing. Major clinical trials failed to show meaningful cardiovascular benefit with niacin. Meanwhile, niacin frequently causes flushing, can affect blood sugar, and may cause liver-related side effects. Aside from these side effects and risks, the focus in optimizing health is not simply about changing numbers. We care about improving outcomes, and this is where niacin falls short. So if I had to summarize all of this into a simple ranking, Tier 1, soluble fiber, has consistent evidence, it's safe, affordable, and fairly easy to incorporate into a regular routine. Tier 2, plant sterols, and for selected patients, berberine. Both have evidence for modest LDL reduction. Tier 3, red yeast rice. As we saw, it can work, but concerns about quality control make it harder for me to recommend more broadly. And for LDL lowering specifically, garlic pills, fish oil, and niacin generally aren't where I would focus my efforts. As always, talk with your physician before taking any supplements. The bigger picture is this. If you're looking for a natural approach to lowering your cholesterol, the most effective strategy isn't usually found in the supplement aisle. It's found in your overall dietary pattern. This is where the portfolio diet shines. It combines foods rich in soluble fiber, nuts, soy protein, and plant sterols, and studies have shown meaningful reductions in LDL cholesterol up to 30% using this approach. I included a deep dive on this dietary pattern in last week's video, so make sure to check that out. Now, I'd love to hear from you. Have you tried any of these supplements? Let me know in the comments below. If you enjoy evidence-based health content, be sure to subscribe. I hope you found this information helpful here today, and until next time, be well.